Bonjour tout le monde. Hello, everyone. Another combat vet who says he was offered medical suicide comes forward. She sought help in crisis and was suggested MAID instead. Spina bifida patient says Montreal hospital twice offered MAID unprompted. L'aide médicale à mourir. Ça vous dit? These are headlines from recent Canadian news stories highlighting the deeply troubling reality of medically facilitated death being offered and promoted by government bureaucrats to people who are not asking for it. Discrimination and coercion that undermines the experience of people trying to access supports that they are entitled to. Let's take a closer look at one of these cases. Nicolas Bergeron, a 46-year-old man in Quebec, was not interested in medically facilitated death. But a social worker who came to his house for an entirely different reason repeatedly tried to push him to change his mind. She presented a very bleak worst-case scenario for his illness and told him that sometimes you just have to stop fighting. Imagine being a veteran calling for routine practical help from the Veterans Affairs Department, expressing frustration about the lack of effectiveness of the response, and then having the person on the other end of the line say, well, have you considered death instead? This is wrong, and this is not a one-off. This MAID coercion by non-experts in positions of authority is part of a troubling pattern. Krista Carr from Inclusion Canada recently told the Finance Committee that she receives complaints on a weekly basis from people with disabilities who are facing MAID coercion. And so it is in this context, to respond to the concerns of veterans, people with disabilities, the elderly, and people living in poverty, that I have put forward Bill C-260, an act to prevent coercion of persons not seeking medical assistance in dying. As the name suggests, this bill does not apply to or impose any limitation on a person who is seeking medical assistance in dying. It only applies to those who are not seeking medical assistance in dying. Ce projet de loi empêcherait les fonctionnaires gouvernementaux de suggérer ou de promouvoir l'aide médicale à mourir auprès de personnes qui ne l'ont pas demandé. Il ne s'applique pas aux médecins ni aux infirmières et il ne s'applique pas non plus lorsque le patient ou le client a lui-même demandé de l'information. Toutefois, les Canadiens en situation de handicap, les vétérans, les aînés et les personnes vivant dans la pauvreté ne veulent pas que des fonctionnaires leur suggèrent la mort lorsqu'ils tentent simplement d'accéder à des services gouvernementaux sans lien. La loi canadienne prévoyait que ces conversations délicates aient lieu entre un professionnel de la santé et un patient consent, et non entre un fonctionnaire et un citoyen qui n'est pas intéressé. Pourtant, cela s'est produit à maintes reprises. Bill C-260, an act to prevent coercion of persons not seeking medical assistance in dying, does not apply to or impose any limitation on a person who is seeking medical assistance in dying. It only applies to those who are not seeking medical assistance in dying. This bill seeks to address the existing gap in Canada's MAID law by prohibiting a government bureaucrat in a position of authority from proposing MAID to a citizen who is not asking for it. If passed, this law will provide robust protection for people with disabilities, veterans, and others who are trying to access government services. This bill also includes a clear and blanket exception for doctors and nurses. Obviously, medical staff should also approach these conversations with great care and discretion. But my bill focuses on the most extreme cases of people who are not even supposed to be delivering health care. I want to be pragmatic and put forward legislation that will stand a reasonable chance of passing in the current Parliament. I hope that this precise focus on government bureaucrats, excluding doctors and nurses from its application, will give this bill its best chance of moving forward. Difficult conversations about MAID happen between a willing patient and their healthcare provider. They should not happen between a bureaucrat and a citizen who is trying to access unrelated services. La loi canadienne prévoyait que ces conversations délicates aient lieu entre un professionnel de la santé et une patiente consciente, et non entre un fonctionnaire et un citoyen qui n'est pas intéressé. I want to conclude by recognizing the work of Blake Richards, our Shadow Minister for Veterans, on this very important issue over a number of years. Blake was unfortunately not able to be here this morning, but he has been an incredible champion of veterans who have been victims of this kind of coercion and has worked hard to bring their cases before Parliament and to a wider audience. So I want to thank him for that work and thank all of those who have come forward. Obviously, it's not easy for people to speak out when they are in these kinds of situations, but there has been so much commentary and discussion of it that we see what a problem this has become and why we need Bill C-260 to step into that. Thank you very much, and look forward to your questions.
Mr. James, I wanted to ask you something on a bit of a different subject, but one of your colleagues, Jamil Javani, going down to the U.S. and meeting with some members of the White House yesterday, posting on social media that he had some positive meetings and saying that the president sent a message as well. What do you think about his efforts? Do you think that this is part of the Team Canada approach, or do you see it as freelancing?
Well, I don't know the details. I know that a government minister provided him with a briefing, but I only know that because I read it in the news. So I'm not involved in international files right now. My focus is on this bill, and my responsibility is the Shadow Minister for Employment. So I don't have any additional information I can give you.
I can appreciate that, but when you consider that the relationship between Canada and U.S. is so important, and how you have different prime ministers, Chrétien, Harper, and even Carney, talking about a Team Canada approach. How do you put Mr. Giovanni's visit in that sort of spectrum?
Well, I understand it was briefed by a government minister. I don't know all of the circumstances.
To try and do some work on.
Well, but you're asking me to comment on something when I've already told you that what I know about the conversations that have happened, the coordination that have happened, is what I've read in the news. I'm not involved in the file.
Going and doing that?
I'm not involved in the file. Any other questions, preferably on the subject we're here to talk about?
Well, I actually wanted to ask you about the new legislation for the Build Canada homes that the government is presenting this morning.
This respectfully, I mean, this is a critical issue for the well-being of people with disabilities, veterans. Does anybody have questions in relation to that?
Well, I just want your thoughts on this. The government seems to be giving itself the power to expropriate land with this new legislation. Do you think that's something that it should be doing?
My understanding is the legislation was just tabled. I look forward to studying it in detail, and I look forward to discussing it with colleagues and participating in the debate on it.
On your piece, are you do you expect cooperation from the other parties on this? Have you talked to anybody?
I would hope and expect that something as basic as saying a bureaucrat should not be pushing MAID on someone who is not interested in having that conversation. I would hope that something as basic as that would get wide support in the House of Commons. I can't say for sure. I'll be making the case, and I hope Canadians who are concerned about this issue will also contact their members of Parliament, share their concerns. So we'll see where the chips land after that.
Thank you.
Okay, thank you very much.